Thanks for tuning in today. I'm Assemblywoman Dahle, representing the 1st Assembly District, which encompasses the northeastern corner of our great state, 9 counties, and 25,000 square miles. I hope everyone who's watching today are well and safe. I know it's hard to stay positive during these uncertain times, but we just thought we would start highlighting the great work that's happening throughout AD1 and talk with individuals that are helping our community members. Today, we are joined by my good friend, Shannon Gerig, on behalf of Mountain Valley Health Centers. This organization provides primary care, behavioral health, and dental services to 7 small communities in the northeast corner of the state, 8 family practice clinics. 3 of their sites have dental clinics included. Shannon Gerig recently took over as CEO of Mountain Valley's Health Center in August of 2019. She's a registered nurse and has worn many hats over the past 25 years. She is very loyal to the organization and its mission to provide quality health care to our rural communities. Shannon is here today to give us a perspective on rural health care during these unprecedented times. Good morning.
Morning.
I'm so glad to see your face. We haven't seen each other in a while. So today we thought it was actually you and your staff's great idea to switch it up from questions to doing myth or truth, which I think is very important during this time right now. We're inundated with facts and figures, watching the news. We were just discussing how many meetings we are on, different updates. So I think it would be really helpful for all of us to hear what the truth is. So the first one, myth or truth, sick patients in the clinic, so I don't want to be there. I don't want to be seen. If there's sick people in the clinic, I don't want to go there.
Right, so it's been pretty interesting with all of the hype on the media, but we have put in a lot of procedural things. So patients that are symptomatic are being screened at the time of scheduling, and then we are screening them again when they come to the front door. So if any patients are found to have a fever, a cough, difficulty breathing, then we use an alternate plan. So if it's at the time of scheduling and the patient is having difficulty breathing, then we have that patient channeled straight to a nurse so that we can triage them and take care of them immediately. If the symptoms are not urgent, then we offer them a video or a telephone visit. So this helps keep the sick people out of the clinic. If the patient is at the office, maybe they don't think that they have a fever, and they get to the office and we take their temperature at the door and they do have a fever, then we ask them to return to their car, and then we have our provider go out to the car and see them and screen them in the car. And then the provider is able to determine at that time if they think if they're suspicious for COVID, if we need to do testing or whatnot. But most of those situations are handled at the car. And then we also have in place for all of our clinics have a designated room that we consider close to the back door, where we can shuffle the patient in real quickly so that they go straight into the exam room and be seen, and then those exam rooms can be aired out before they're utilized again. Anyway, so we're learning new things, having alternate visits, video, telephone, in the car. It's all kind of new, and we have kinks that we are working out, and hopefully it's going to become more natural. And hopefully we'll be able to keep these alternate visit types for the future too.
Those are some amazing steps. I know we went in not very long ago and the waiting room was completely empty, and it feels a little, you're used to going to the clinic and seeing people, saying hello. But the next one is, I heard a patient coughing the other day loudly in the clinic. He must have COVID or pneumonia.
This is not true. So, people have coughs for many different reasons. Sometimes coughs are instigated by medicines that they're taking. Of course, it is time for seasonal allergies are hitting, and we have lots of patients who seek care during this time. They could have asthma, COPD, all of which exhibit, a dry, deep cough. And sounds frightening, but we really want people to trust in our system. We're here to protect our patients. We're here to protect the staff. And the last thing that we want to see is staff or providers to come down with COVID. So we truly are being vigilant in our processes. And just this week, we've put in another strategy into play just to reassure patients and staff. And that is, as patients enter into the clinic, we are having them wear a mask. And so staff might be talking to the patient on the phone when they're scheduling the appointment and asking them to come in with a mask. And if they don't have a mask, then they will be provided one when they get there. So yeah.
That moves into the other one. People wearing masks must have had exposure to COVID, or they wouldn't be wearing those masks.
Right, exactly. So, it's a new recommendation by Governor Newsom that we're asking people to wear masks. And, it just really provides a barrier between the patients, the providers, the staff members, and helps prevent the further spread of this terrible virus. And it's not because there's been an exposure, but because we don't know what the virus looks like. It's just a safety precaution. So there we go. And, most people who, some people are carrying the virus and they're asymptomatic. They don't even know they have it. So the mask is just a precautionary thing so that we're protecting everybody.
Well, I noticed, we just spoke yesterday with a grocery owner, and that was one of my questions to him. Would it make your staff feel more comfortable if, people who are coming to the store were wearing masks? Not that you're sick or that you think that you are, it's just so everyone feels more safe, during these times. And so he said, absolutely, it would. And I'm sure that your healthcare workers also will feel more secure because they truly are on the front lines. So that's really good, because we're starting to, you're starting to go out into public a little bit more, and you're seeing a lot more masks, and it makes you uncertain, and talking to your children if they're with you, and now everyone, this is very odd, to head out into public and everyone's wearing a mask. So
right.
That's really good to know that it's more about just the protection of everyone around them, not that you're infected or sick yourselves. So I think that's really good. Something else that I've talked to a few people about, I don't want to bother healthcare workers with my prescription refill or with my insignificant, we have in parentheses, healthcare needs. How can I be so selfish when providers are focused on treating COVID patients?
Right. So, it's kind of interesting because, you watch the news and you see all this hype, and the hospitals are just inundated with sick people. And for us in primary care, and this kind of goes across the North State, we're meeting with sister clinics, and everybody has seen this real decline in patient visit. But all of our patients are important. All of it matters that your healthcare matters means something to us. We don't want to lose where we are with people in their preventative health. So it is difficult because preventative health has been one of those non-essential visits. And so we have really taken a step back, and we're trying to see more urgent type needs. However, it's been unfortunate that COVID has frightened people away from the clinic setting. So, the significant reduction in visits, it is concerning. And like other businesses that are suffering, we too are having a tough time. So we are fortunate that we're a federally funded clinic, and we're going to see some federal dollars to offset some of our costs, but it is tough right now. And so we completely understand people are fearful and are afraid of the virus, and it's hard to escape media and the reality of what damage and heartbreak the virus has done. So we're being patient, and we're really letting people come to us when they're ready. But Mountain Dollies is here. We have appointments available with your provider. And if you don't want to come into the clinic, we have other avenues to see patients right now. Medicare has really been helpful with loosening up the guidelines, with being able to see patients on the video conferencing. We have telephone visits with our providers. Internet has been really tricky up here in the northeast corner of the middle of nowhere. We don't have real reliable internet. So sometimes the video visits are hard. But there are other options to help our patients. And by no means do we want people to stop taking their medicine. because we all know what happens when we stop taking our medicine. It just leads to more significant problems, especially people who are taking blood pressure medicine. You know, the increased stroke or heart attacks, all of that stuff goes up significantly when we lose track of what our blood pressure really is. So we're encouraging patients to reach out to us and let us find a way to help you. So we can, we have these other options, and I think it's a great time for people to test them out.
No battery.
Oh my goodness, my phone. So another one, I don't want to have my baby be seen because it's too risky to go to the clinic.
Yeah. You know, we've been really concerned with that ourselves, because it's been really this struggle of like, okay, we know that we need to have this well baby care, but we haven't been able to figure out, you know, is it safe? How do we make it safer? So we kind of reached out to some of our health plans to ask what they were recommending. And, you know, they're very adamant that these kids, especially the children who are 0 to 24 months of age, so the little guys, you know, they want them to get routine care. Our pediatrician that we now have on staff, Dr. Tiffany Fry, she's been super adamant that these kids have to be seen for complete physical exams at regular intervals. You know, they're critical milestones during the short period of life. They can't be diagnosed with a video visit. And so these kids also need their vaccinations, and we all agree that the last thing we need is an outbreak of pertussis or measles. So we're really trying hard to keep our little ones coming into the clinic. We have a lot of strategies in place, and we're really hopeful that we can continue this service.
That's really good, because that is something, you know, as maybe a new mom, you would be nervous. You're just not sure what the best course of action. So communication sounds like it's really big. Call the clinic, ask the questions, see what you can do to make still keep those visits happening. So that's the next one. We've all heard the you know, the rumors that our kids are Peachtree dishes for COVID.
So yeah, we all know it's true that children are carriers of the virus, and we know that they're carriers of every other sickness there is. They love to share their germs. So, you know, really, to be frank, I'm really thankful that the kids are not suffering from COVID. I just can't even imagine how tragic it would be to see the little guys going down, but they seem to be very resilient and just passing through with COVID symptoms and not even knowing it. But Mountain Valleys has been taking precautions to keep children isolated from other patients. So when children have an appointment, we ask that only one parent accompany the child. So once they arrive, they call into the clinic to let the staff know they're in the parking lot. And then they're met at the door, and they have the same temperature check, you know, the parent and the child. The screening questions are asked again. And then once they're passed through the front door, they're escorted straight to an exam room. So really trying again to eliminate people sitting in the lobby. It is kind of sad though, because there's a lot of old timers up here in the middle of nowhere, and oftentimes the lobby has been a social place where people can visit and mingle while they're waiting. So the lobbies are pretty empty, but we are doing our best to keep these children separate from the adults, and we have designated for those patients.
That's good. So I think another thing people are, you know, about going to the hospital, even if they have you know, I mean, people are still going to have appendicitis. Things are still you're going to break your leg. There's still going to be things that are happening right now. So COVID-related health issues are the most important for hospitals to treat. Everything else has to take a back seat.
Right. So I think too, I think there's this thing, you know, sick people are congregating in the clinics or at the hospital. And though that is true, you know, I sit on calls every week with the hospitals and other clinics, and hospital numbers are down too. People are really staying at home. And we've been kind of, you know, chuckling about what it is usually true. There are usually sick patients sitting in the clinic, but the pandemic has kind of changed this. You know, we have less sick people, and we think it's for a variety of reasons. So we talked about the kids and how the little germ spreaders are not at school and they're not with their grandparents. And now all of a sudden everybody's, you know, kind of doing this social distancing and isolating. And then we also have seen less cases of like cold and flu and just in general the upper respiratory systems. And so if you think about it and you think about all the people who are watching the news, and now the hand washing, everybody's washing their hands. People are vigilant about, you know, they're wiping down door handles, they're steering wheels in their car. They're doing things that like we never ever thought of before. And so all of these skills with hand washing and sanitizing everything are probably affecting the upper respiratory system as well. And then I think the social distancing, people aren't sharing it and keeping to themselves. So I think all of that and the procedures that clinics like ours have put into place and other places, you know, we all have procedures that really help prevent the spread. And so I think that's why we're kind of seeing this decline and not all this urgent stuff. But so there's not a lot of sick folks coming into the clinic right now, but it's not a bad thing. It's kind of a good norm. Anyway, right. We also have kind of implemented strategies around, you know, maybe we should see the well people in the morning and the sick people in the afternoon, or the quote unquote sicker people, the people who have complaints of diarrhea or, you know, other types of illnesses. We've been trying to schedule them in blocks of time so that we really try to separate our well people from our sick people.
Yeah, that's good. So your dental clinics, even in our own house, we have a couple dental needs right now. And, you know, you hear on the news that they've closed down dental clinics. You can't, I mean, that's, I guess, myth or truth. I cannot get a dental appointment for my infected tooth right now.
So it is not true. If you do have a dental infection, it is considered an urgent visit. So the truth of the matter is that they have really put a kibosh on the dentist. So we too have dentists that are not working, and it's really quite sad. But a lot of dental procedures, they produce these aerosolized germs in the air. And so that's the whole thing with COVID, is that it is a droplet transmission. So if you have these dental droplets that you are producing in the dental chair, it has potential to spread like wildfire in dental. And the other thing about dental is because they do these aerosolized procedures all the time, they utilize a lot of the PPE. And so, you know, the concerns over not having enough PPE, we, Mountain Valleys, has been fortunate that we've been able to utilize our dental supply of personal protective equipment and utilize it in our medical departments. So for Mountain Valleys, I can say that we have been providing urgent dental appointments. So if you do have a tooth that is bothering you, or you have some problem that arises, please call in and talk to our staff member. We have a dental hygienist who is working from 8 to 12 every day, and she is triaging patients, and she is scheduling patients who are urgent into a dentist schedule at the Big Valley Dental Clinic. The phone number is 999-9011. So she's available, and she's really helpful. And if she doesn't have answers for you, she will find them. And we've had two successful dental days. So we're going to continue just one day a week with patients.
That's really good to know. So Shannon, I just want to thank you so much for joining us today. And I want to give you a chance for any closing comments, how to get a hold of you, your website. I know the Mountain Valleys is active on social media, and, you know, up to date there. Just give you a chance to kind of let us know how we get a hold of you.
Sure. So, you know, thanks, Megan, for letting us have time to share information and facts about Mountain Valley's efforts against COVID. We pray every day that there's going to be some vaccine or cure that's going to treat this deadly virus. I think we're fortunate in the northeast corner of nowhere that we, our communities are blessed just in so many ways. We've got fresh air, we have open spaces, but more importantly, you know, communities love helping one another. And so the support from the community has been a real morale booster for staff. People are dropping off homemade masks and now gowns, and the gowns is kind of a neat story. I have a friend, Kathy DeForest out of Aden, who kept texting me and asking how she could help, and I just needed to ask. That's what she kept saying, just ask anything. So when the shortage of gowns became apparent, I ended up texting her and saying, hey, do you know how to sew a gown? And she replied right away and said, well, if you can get me a pattern, of course. And so we gave her a paper gown, and away she went. She went to the fabric store, and she worked with the lady at the fabric store, and she said, the material has to be water resistant and it has to be washable. And she started with all these things. So here she came a few days later to the clinic with this gown that she had made, and she wanted to make sure that it fit and that it was everything that we wanted it to be. And of course it was fantastic. It was way better than any paper gown that we had been utilizing. And anyway, we were really tickled. And so away we went. We ordered a bunch of material, and we thought we could really mobilize the community to sew gowns, because we don't know if we're going to get any more supply. So, you know, Kathy has sewn 5 gowns for us. You know, she was working on Dr. Dahle to make him a special cardinal red one. Anyway, so as we got the material in, we were seeking more sewers. And so our board chairman, Jim Billow, his wife, Kathleen, she said, I would love to help take this project on. I belong to a sewing group in Bernie. So she took a bunch of the fabric, and she worked with a friend of hers, and they cut the fabric down, and they made these little kits, and then these kits were given to different sewers in the community, and so they started sewing these gowns. So she delivered 14 gowns the other day, and then we sent some of the material to the ISOC community up in Canby because they wanted to be helpful. So they have delivered some gowns, and Bernie Rotary has gotten involved. So it's turned into this really great thing. And so not only are there all these fun masks that people are sewing, but there's also these gowns that are appearing that are going to be helpful in the clinic to protect the staff. And it's really amazing. But the support has just, it's been really nice. We even have restaurants who have made lunch for the staff for free and just delivered it. So it just seems over the top, but we're so thankful to have a community that just contributes and supports and is generous over and over again during hard times. So I guess in closing, Mountain Valley just wants to make sure that we don't lose focus of the virus, and we encourage everybody to continue to follow the social distancing guidelines. You know, we sit on a lot of collaborative calls with Shasta County, Siskiyou County, Lassen, and everybody's saying, you know, our peak isn't going to come until May, early May. And so we're going to have to be really vigilant to get through this marathon, because it's hard to be apart from everyone. But I think it's pretty encouraging to see that, you know, Shasta County is at 25 cases today. They've only had 1 case in the last several days. Siskiyou is holding at 5. Lassen and Modoc have none. We even keep track of Klamath County because they are on the northern border of our northern clinics up in Tule Lake and Butte Valley, and Klamath County is holding at 26. So even though the numbers are low, it only takes one hot spot to turn that into a different story. So just that people can be vigilant and practice the social distancing and keep protecting the ones you love. I think if you have appointments that you've been putting off, I think it's a good time to call the clinic and find out if we have an option that we can help you. We certainly don't want to see repercussions of people not taking care of themselves and getting them into a bad spot later. So health is really important, and we don't want there to be any barriers to care. So thanks a lot, Megan, for taking time. It's been fun.
Yes, well, thank you for joining me again. And this information and more updates are available on my website as well. God bless you and your families. Thank you for staying safe and staying home right now. And we're all in this together. Have a great day.
All right, thank you.
Thank you.